My name is Sean Rumrill. I am a general surgeon at Falmouth Hospital, and I've been there for about 2 years. So coming into Cape Cod Healthcare as a new graduate from residency, I had the utmost support from the healthcare staff and my partners. They were able to offer themselves their time and experience whenever I needed them. So my journey with medicine started a long time ago when I was a child and diagnosed with Crohn's disease, and it wasn't until much later in life that my life was actually saved by a general surgeon. And when I was reevaluating my life as an adult and figuring out where I wanted the direction of my life to go and how I wanted to affect people, it was the general surgeon that saved my life that made the biggest impact. And that is ultimately what led me to the career path of being a physician and ultimately a surgeon. One of the best parts about Falmouth is that it is a small town, and it very much has that small town vibe. I enjoy being able to see my patients out in the community, and it didn't take long for me to have multiple patients of the same family and them all know each other and get to know me as well. It gives me a very proud feeling to be able to help the community that I live in such an intimate way. And whether it's the neighbors or proprietors of the local businesses, I get to know so many people on the Cape and get to touch their lives in an exceptionally special way and help them. Each day coming to work is meaningful for me, and I find the most rewarding times are actually some of the most difficult patients to take care of. You find that the patients and the cases and the illnesses that are the most difficult and arduous are actually the most rewarding. And each time that happens, I am significantly touched and moved and am proud to be able to help those individuals. In our spare time, my wife and I really just like hanging around the house, and we love to build fires in our backyard, sit around with friends and family, listening to music, and having a good time. One of our favorite things to do in Falmouth and the Cape in general is explore the local restaurants and eateries. The food on the Cape is much different than where I am from, which is the Midwest, and so it has been a great adventure exploring all the different restaurants and bars and local eateries. I never saw myself working anywhere other than the operating room. There is just an atmosphere and camaraderie within the operating room that touched me from the get-go. And being able to work with my hands and see a problem, diagnose it, and have the tools and the knowledge to fix it is the most rewarding thing I could ask for. One of my favorite aspects of surgery is seeing that follow-up appointment when they come back and they are feeling so much better. And when you first met, they're miserable. And then they come back and they say, "Thank you. Oh my gosh, thank you." And it's honestly, from physicians, no matter what area of medicine that you practice in, it's being able to help your patients is what makes it worthwhile. So Cape Cod Healthcare definitely gives a academic center level of care in a community setting. And that is one of the greatest selling points of the care that we are able to provide for our patients. And that really just comes down to the dedication that everyone who works here have for providing that level of care to our patients, whether it's the physicians, the nurses, the physical therapists, the administrative staff. Everybody is dedicated to the same goal.